Sonny, you gotta be cool.
Aww. These 5 women brought together because of the pandemic. Each have or had loved ones being cared for at the Lynn Valley Care Centre.
I think we were quite traumatized for a long, long time, and we still are.
They recall the chaos from when they were still allowed inside in those early days. Pleas for help from residents going unanswered. Trays of food stacking up untouched.
Isabel was herself in the same position that we'd left her in the night before. So 16, 18 hours in the same position, curled up. Her diaper was no exaggeration, about this thick. It was very heavy, it was cold, she was shivering, and she didn't really come back from that.
94-year-old Isabel McHale died on March 18th after testing positive for the virus.
There needs to be an overhaul of the system so that we can find a way to care for our elders in a way that is humane.
The Lynn Valley Care Centre was where Canada's first COVID-19 related death was recorded. In total, 20 residents died there from the virus. And in the eyes of these women, it could have been avoided.
I remember when we were all together in the room and one of you said, "We all know what's going to happen here. We all know what is going to happen to our loved ones."
That's Kelly Shillard. We first spoke to her in March through her window.
I want to go back in for my dad, but I'm worried for myself and my son.
She was in quarantine after visiting and caring for her 82-year-old father, Bill, who ended up testing positive for COVID-19 but survived.
They don't have the staff to help my dad to thrive.
In a written statement, the care home says it did everything possible to stop the spread of the virus and admits while there was staffing shortages at one time, replacement staff were brought in.
It feels very, as we talk about it, distressing.
Debbie Drew and Dina Harlow, whose 96-year-old father Graham is in the care home, say the issues are systemic and predate COVID-19.
The virus situation has shed a light on a very dire situation. There's still people. They've had great lives, they've got great families, and they're still living.
They want to see an inquiry, and the health minister says a review will be done in due time.
There are going to be reviews, of course, of our COVID-19 response, of all of our COVID-19 response once it's over. But we're in the middle of this now, and we've got to continue the momentum of making improvements in long-term care.
He says the hours of care per resident has gone up in this province, but admits much more needs to be done.
If we really acknowledged how our elders were cared for, it would break our collective hearts, because it's not okay.
And they say we need to do better, pandemic or not. Tina Lovegreen, CBC News, North Vancouver.